The NESP program, or NESP program, is an acronym. It stands for Nutritional, Emotional, Social, Financial, Physical, and Psychological, what I call the 6 aspects of chronic pain, or the chronic pain experience and the addiction experience. Basically, it's an integrative technique to treat all aspects of the problem. All too often what we see is that people focus on what I say the P, which is the physical. More physical therapy, more injections, more pills. But when you focus on all the aspects of chronic pain, all the aspects of addiction, then the success rate of curing these problems goes through the roof. We do a lot of treatments at GS Medical that are different than anywhere else. One of them is something called nanovated technology, which is where people are placed in hydrotherapy baths where the water is actually nanotized. And nano is just a unit of measure, very small. So when you put someone in nanotized water, the bubbles are so small, they go right into the body, right into the cells. They can detoxify a person faster. They can also oxygenate a lot more effectively. And all pain is a result of what I call oxygen debt, meaning there's not enough oxygen. When someone's having a heart attack, they're getting a heart attack because there's not enough blood flow or not enough oxygen. So the more oxygen you get to a body part that's in pain, the more relief you get. We also do Reiki healing, which is very, very effective. Most of our patients just love this because it's an energy technique or energy healing technique where people can really feel a difference just in a 60-minute session. We use deep brain stimulation with a device called Nexlin. Nexlin's the first device that does this without actually putting electrodes into the brain. You use electrodes, 1 going on the forehead, 2 going on the sides. This is very effective for anxiety, depression, headache, insomnia, chronic pain in general. We have class 4 laser therapy. Class 4 laser is different than the normal lasers that you see in most offices. It is very powerful and can go all the way deep down to literally the level of the bone. It does 2 things that are interesting. 1, it reduces inflammation, and secondly, it increases blood flow to wherever the problem is. Very good for joint pain, such as the knee, shoulders, and it has a cumulative effect, just as the nano treatments have. So the more that you do them, the more relief that you get, and it's long lasting. I'm always about making sure that when a person gets better, that it is permanent. I think that if your doctor's doing a good job, you won't see your doctor very often. You'll see the doctor maybe at the mall or something, but if you're going to your doctor every week, every month for years and years and years, how are they making you any better? That's just a boomerang situation. I want to see people get better and move on. We also have something called Cellupulse, and Cellupulse is a sound wave technology which breaks up scar tissue. It also has a lot of wellness and wellness benefits along with cosmetic benefits. It works for cellulite, so a lot of women come here for treatments for that, although it works great for, again, pain in the joints and different areas of the body that has musculoskeletal pain. The other thing that makes the NESP program really unique is the IV protocol, and what this is that we have an IV in the patient anywhere from 3 days, sometimes up to 5 days at a time, where they're given multiple things through the intravenous line. Most of these are natural, but we do give people some medication depending if they're having any side effects. But people are getting nutritional drips, they're getting things like glutathione, they're getting amino acids, they're getting the building blocks of what's needed in the nervous system to balance brain chemistry, because balancing brain chemistry is extremely important when you're treating pain and when you're treating addiction. The nutrition program is extremely important. When we do the IV protocol, we try and jumpstart a person, because a lot of times when patients come here, they're not really doing well from a nutritional standpoint. So in the IV, we're able to give nutrients at a very fast and high rate. But the nutrition program is important because it's really a lifestyle lifestyle change that a person has, where they can learn to not just eat the correct foods, but really eat for what's right for their brain. And it's a unique process where we look at the brain chemistry again. If a person's lacking in things like serotonin or dopamine or different neurotransmitters that has to do with a person's mood, has to do with a person's energy levels. So you can achieve a lot of this by eating the correct way through your foods and your diet, and also nutritional supplementation. The problem with pain medications are that they work. They work, so people take them because it makes them feel better. But that's a double-edged sword, because once they work for a few weeks or a few months, these turns into years, decades. Medications for pain are made for acute pain. So if you're having surgery, or if you've been in a car accident, you've broken a bone, there's nothing wrong with taking a pain pill. But what happens is that when someone develops a chronic pain syndrome, most physicians are not sure what to do, so they keep treating it with medications that are really designed for acute pain. This is how people become dependent, and some people become dependent and addicted to opioid medications and other medications for like anxiety, sleeping pills, etc. So over time, the body adapts to this. The nervous system is very plastic. So in other words, the more pain signals that hits the nervous system, the more medication that's given to the nervous system changes over time, and a person becomes resistant, and they need more of the same medication to get the same effect. This is called tolerance. But another thing that's less known is something where a patient can actually develop pain from the pain medication. It's a paradoxic situation where a person can take more pain medication and it actually gives them more pain. It's almost a self-fulfilling prophecy. So what we have found is when we detox patients, and I hate that word detox because it sounds like a person's an addict. Some people just need help getting off these medications. But when you detox these out of a person's system, often what you see is that the pain levels go down because they were having the situation where they had narcotic or opioid induced pain. The problem with pain management in this country is that it is symptom treatment based and pharmaceutical based. So in other words, you come in with pain, they find out where the pain is, and then you end up walking out of that office with a pill for that pain. That is a Band-Aid. That is not a cure for the pain, but it's become the cure. So what happens is someone takes the medication, they feel better, the doctor feels better, problem solved. See you in 30 days, here's another prescription. And then a year later, 5 years later, 20 years later, the person's in the same situation. However, when you take these medications for that long period of time, there's all kinds of negative side effects on the body. So what we want to do is we want to treat the root cause of the problem, get rid of the pain, not just cover the pain up with medications, but do something so you don't need to take medications and you can have no pain. Our bodies were not designed to take medications for the rest of our life for every ill. Can't sleep, there's a medication. You're a little stressed out, there's a little medication. You're in pain, there's medication. That is not natural. The natural thing is to get a cure, move on with your life without the medication. The main reason I developed the NESP program back in 2005, and it's come a long way in the last 10 years or so, was because I saw a tremendous void in programs that treated people for chronic pain or addiction. It was either or. In most places that treat people with addiction, they're lumped all in together, whether they're addicted to alcohol or street drugs or prescription drugs, and people ignore the pain component. So what this really started out for were people that were in chronic pain that were also dependent or addicted to painkillers. So most people think that you either have to be in pain and off the medication, or out of pain or somewhat out of pain and on the medication and be in a zombie state. They're not mutually exclusive. You can be out of pain and off the medications at the same time if your brain chemistry is balanced, if you use alternative and complementary medical techniques to get people better. If I was a person that was taking a handful of pills every day for my pain, I would ask myself, what am I really accomplishing? Am I completely out of pain? Am I just taking the edge off and I'm unable to do anything but sit on the couch and watch television? I can't drive a car because I'm always under the influence of medications. I'm forgetful. I can't concentrate and read a book because I'm so medicated. Ask yourself, do you want a life like that, or do you want to actually get out of this and be better? So many times people are told by doctors, you have to live with the pain. That is a ridiculous statement. In this day and age, there's too many things available for anybody to live in pain. I don't care what your situation is, and I have seen it all. I've seen people on multiple prescriptions for 20, 30, 40 years come in with 10, 15, 20 different medications they're taking a day and get off of that stuff, be better, and live a productive and normal life. Now, if you've had multiple surgeries, which I've seen before, people had 5, 8, 10 low back surgeries, neck surgeries, you can't repair certain things that have been sort of broken or interrupted by surgical techniques, but you can definitely be better and definitely be off all those medications and get better in terms of feeling less pain at the same time.